Welcome back to another video tutorial. We will be covering two different systems today, reproductive and respiratory systems. This, again, is not an exhaustive lecture on it. Please use your PowerPoint and your textbook, but I hope that this will just help you with the information as we go along, because there's some commonly missed questions that we'll cover today, at least in content. I do not have a great reproductive model for male or female, so I'll do a little bit of drawing, and also your textbook has great pictures. Page 136, 137, and 138 all will help you. Again, use your textbook. Those pictures in color in the back are to help you with anatomical structures, so please use them. For a reproductive system, we're going to go over male and female, starting with male. With each of these structures we talk about, you need to know their location where you could identify them, but also understand their function as well. Let's start with male. So with males, we're going to start with scrotum. We'll start just external. So scrotum is just the housing place for the testes. And the reason they're outside the body is because it's easier to control temperature regulation. That sperm actually likes to be a little bit cooler than body temperature, and the scrotum allows for that to occur. Within the scrotum, you have two testes, a right and a left, right? Now, I know you're all thinking you know all of this information, but inevitably, at every final, people miss multiple questions on reproductive systems. So just because you may own a pair of these, or you don't own a pair, but you think you know about them, still study, trust me. Back to testes. All right, so you have a right and a left. And with one testicle, what you have inside is really a network of seminiferous tubules. And within these seminiferous tubules are immature sperm that start to develop. They're called spermatozoa. And as they develop, they kind of work their way through the seminiferous tubules, through the ducts, and eventually kind of up to the most superior aspect of the testes, to what we call the epididymis. At the top of the epididymis, it then kind of comes down into a tail, and then you go into your vas deferens, and eventually, coming around by the bladder is the prostate gland. And right at the prostate gland, you have what's called an ejaculatory duct. And sperm goes through the vas deferens to the ejaculatory duct, through the prostate gland. Now, the prostate gland and other glands add fluid to this component. So you now have sperm and fluid, which help the sperm survive and help them continue on through the prostate gland, goes through the urethra and out. Now, the urethra is the same pathway as urine. Remember that? Urine and sperm do not go in the urethra at the same time. It's one or the other. It's not both. But it's the same pathway to exit the body. So for males, same pathway to exit the body. Now, female reproductive system. So that's a quick overview, right? It's really pretty straightforward. Make sure you can identify the structures, though. Make sure you look through that. Females, again, it's not too hard once you just have someone explain it and walk it out. Sometimes you get bogged down in stuff that's in the textbook. I'm hoping this video will help. Females, you have ovaries. Now, ovaries produce hormones for female characteristics. You see estrogen and progesterone. For males, the testes produce testosterone, and they produce male characteristics. So kind of think of them in correlation in that way. So female, we've got a right ovary and a left ovary that sit out here. The purpose of an ovary, every month, once somebody hits puberty, maturation, is they release an egg. One side 1 month, one the other, and they alternate each month. When they release the egg, there are these little kind of finger-like projections that come around the ovary, and these finger-like projections are called fimbriae, and they are attached to the fallopian tubes. Now, the fallopian tubes are where the egg is released. The fimbriae catch it. They bring the egg along the fallopian tube. Now, during intercourse, when we're talking about the penis enters the vaginal canal, ejaculation occurs, sperm comes in. Now, sperm swims, and sperm swims up into the fallopian tube, and we actually see that the egg is fertilized in the fallopian tube. So that's significant there. But it doesn't stay there. It continues to migrate back to the uterus. Now we have the uterus here. The uterus has this kind of bumped superior portion called the fundus. Then we have the body of the uterus, and then the cervix, where it's kind of most inferior, it's a little bit thicker there, and then that exits into the vaginal canal and then out into the external environment. This fertilized egg comes in and implants inside the uterus. It's kind of this hollow area, and it implants. If fertilization and implantation does not occur, what we see every month is a sloughing off of this inner lining. Now, the uterus has 3 layers. You have an endometrium, the inner lining, a myometrium, which is more of the muscular area, and on the outside, the perimetrium on the outside. When every month we have a sloughing of that inner lining, and then the muscles contract, the more muscular myometrium layer contracts, and it cuts off so that the blood doesn't continue to happen. It starts to kind of constrict and cut off. And then what is sloughed off comes out through the vaginal canal and exits. Now, external genitalia for female, again, looking over, there's a picture on 138. There's also a better picture. I provided one in your slideshow to be able to see external genitalia as well. I know this sounds straightforward, but again, people miss this all the time. So if you're thinking anatomical position, right, and you think female, so what is going to be most anteriorly for our external genitalia is the clitoris. A lot of people miss that. Then as you move posteriorly, then you're going to have the urethral opening. That's where urine comes out. If you continue to move posteriorly, then you have the vaginal opening, and then most posteriorly is the anus. I know that seems pretty straightforward for some of you, but it gets missed on the test, so make sure you understand that. And then you have the labia majora and minora, really the outer pouchings of skin to cover the genitalia. So that's male and female. Pretty quick, pretty straightforward. Make sure you can locate and identify each of the structures that we named, and make sure you understand their function as well. The only other thing left for females is mammary glands, and that is just the sole purpose for when childbirth occurs to be able to provide nutrition for a newborn. So what happens is during that time, the mammary glands become active and secrete milk through the duct system, and it is excreted out of the nipple. Pretty straightforward information as well. Moving on to respiratory system. Respiratory system, we are just going to treat it just like we did with digestive system, where we started from the outside, the garden hose, went inside all the way through, and exited out the anus, right? Same thing with respiratory. We're just going to start the pathway of airflow into the body, and then you just reverse it to exit the body. So when we look at respiratory system, this is a mid-sagittal section of the head and neck. What you see is the nostrils. We're going to call those the nares. You have the anterior nares and the posterior nares. And then you have this nasal cavity in between, which has a superior, middle, and inferior nasal conchae. At the anterior nares is where air first is inhaled, starts coming in. It's warmed and humidified in that nasal cavity by the conchae. Just creates more surface area. At the posterior nares, it narrows, and then we start to see the back wall here called the pharynx. Now the pharynx kind of goes through 3 levels. There's a nasopharynx, oropharynx at the mouth, and then a laryngopharynx, that larynx. If you really think about the Adam's apple voice box larynx area. So air comes in, anterior nares, nasal cavity, posterior nares, goes down nasopharynx, oropharynx, laryngopharynx, and then from there, 2 pathways, and you have to decide which way to go. If you stay posterior, that's the esophagus for swallowing, right? But if you go anteriorly, that's the trachea. All of you can feel on your neck, kind of that bumpy ridge, that's the cartilage of the trachea that helps it maintain its shape. Air goes anteriorly. Now when we swallow for digestion, when we swallow, those muscles with the hyoid bone allow the larynx to elevate, and kind of like a flip-top lid, like a garbage can, it flips the lid down and food has to go down the back posteriorly through the esophagus. That's how food and water don't enter into the trachea. So respiratory, we're going to take the anterior path through the trachea. Once we go into the trachea will bifurcate. It will fork, it will split. And you kind of have a right and a left. And it branches into bronchi. So you have a primary bronchi, it'll branch again. Secondary bronchi, it'll branch again. Tertiary bronchi. And then from there, it gets really, really small in our lungs. And we start to see terminal bronchioles. Oles is just a smaller version. The bronchioles are a smaller version of the bronchi. So we see terminal bronchioles and then respiratory bronchioles. And those respiratory bronchioles are in the alveoli. They end in the alveoli, which are these air sacs in the lungs. Now, around each air sac is a network of blood vessels, and this is where we see oxygen and carbon dioxide exchange. Significant as we continue to move forward as we talk through blood vessels, and cardiac. So let's just review pathway of respiration again. Anterior nares, nasal cavity with the conchi. Posterior nares, you have your pharynx, oropharynx, or nasopharynx, oropharynx, laryngopharynx, trachea, primary bronchi, secondary bronchi, tertiary bronchi, terminal bronchioles, respiratory bronchioles, alveoli. Again, this is just a quick, brief view through respiratory, reproductive. Please note your lecture notes and your book. And if you have any questions, you can always email me. Good luck studying.